We're talking about cancer between the ages of 15 and 39 all morning long and how cancer care supports those individuals. Alannah Raposo is one of them. Thank you for being here. Thank you for sharing your story. It really is an honor to have you with me and tell us about it. So kind of walk us back to when it all started.
So at 28 years old, I found a lump in my left breast and was kind of scared about it and didn't go to the doctor right away. And about 6 months later, decided it wasn't going away, I should go to the doctor. Got sent for an ultrasound, came back kind of inconclusive, had to go for a biopsy, and of course, get the news that nobody wants to hear. Unfortunately, it's cancerous.
And so since then, I mean, I won't ask you for a step-by-step. Don't worry. I understand that it's complex, but you're also going through fertility struggles as well. Now, cancer care provides some of those supports. Tell us about what that all looks like and feels like for you.
Right. So very shortly after you get that diagnosis of cancer, you get referred onto a fertility clinic in Winnipeg, Heartland Clinic. And I don't think a lot of people realize that you're kind of struggling with this diagnosis of cancer, and then also being faced with, if you go through cancer treatment, you're going to need to have fertility support. So it's a long journey. It's something that nobody really expects to have to go through, and nobody really expects to have to pay for, unfortunately, either. It's not covered. So to have to go through that struggle and to at least have the AYA program to be able to support you through it is just, it's something I can't put into words, that kind of support that they give.
What was going through your mind initially, and since you've had some of the support, how do you feel about it now?
I think if I hadn't had the support, I don't know if I could have gone through it as easily as I had. And don't get me wrong, it's not easy, but having the support was so much more helpful. When you go to Heartland, you're surrounded by a bunch of people that are really excited to have a baby. Nobody else really is in there dealing with a cancer diagnosis and is having to do this out of necessity, because if they don't, they may not be able to have kids afterwards.